In this presentation, we will discuss the development of cardiorespiratory fitness for your students, athletes, and clients. We will first review some of the common terms and concepts. We will then review the prescription for aerobic and anaerobic training, determine what percentage of these systems are required in sport, and finally present ways to develop both systems. Download the PowerPoint slides and note page to guide you through this presentation. Pulmonary ventilation refers to the process of inhalation and exhalation. To begin, we will discuss the common terms related to breathing and exercise. Tidal volume is the amount of air displaced with each inhalation and exhalation. Dyspnea is the subjective symptom of breathlessness. This can occur in people who are not conditioned. It is seen as deep, labored breathing. Shallow water blackout is a loss of consciousness caused by a lack of oxygen when the athlete holds his breath underwater. The athlete may not experience an urgent need to breathe and suddenly blacks out. It can be caused by taking several deep breaths or hyperventilating before a dive. The result is an imbalance of carbon dioxide and oxygen. This can be very dangerous. Perhaps you or your athletes have experienced second wind during your athletic experiences or current fitness training. This is when you feel less respiratory and muscular stress than you did at the beginning of the workout. This can be caused by a number of factors. First, it could be that the respirations begin to adjust and slow down after some time. Second, it could be the lactic acid is being circulated and removed from the working muscles. Third, it could be that the muscles themselves are beginning to relax, thus the body is experiencing less fatigue. Fourth, it could be psychologically founded, where the individual feels less stress and more confidence in the activity. Fifth, the circulatory system could be adjusting to the increased pulse, assisting the respiratory muscles in the increased respiration. It is probably a combination of all these factors, especially since they occur both physiologically and psychologically in all systems of the body. Stitch in the side is a cramp-like pain that develops under the left or right rib cage. Some athletes will experience pain in the related shoulder or trapezius muscle. There are a variety of causes for this condition that include constipation, gas, eating prior to activity, and spasm of the diaphragm because of poor conditioning. Weak abdominal muscles, inappropriate breathing techniques, and issues with the underlying organs may also be the cause. To prevent stitch in the side, it is important for the athlete to empty the bladder and bowels and to avoid a large or fatty meal prior to extensive activity. Proper breathing techniques should also be instructed. The following methods can be used to treat this condition. First, have the athlete stretch the affected arm as high as possible. Second, flex at the waist and contract the abdominal muscles. Third, alternate walking and exhaling with each step. So if the athlete experiences pain on the right rib cage, he or she should exhale when stepping on the left leg or the left foot. If chronic stitch in the side occurs, evaluation by a physician is warranted. In the next section, we will discuss the cardiovascular changes that occur from exercise and introduce the concepts of anaerobic and aerobic training. Cardiac performance, also referred to as cardiac output, relies on stroke volume, the volume of blood pumped per beat, and the heart rate, the amount of times the heart beats in a minute. Both stroke volume and heart rate increase during physical activity. A normal heart rhythm for an unconditioned or minimally conditioned adult is 60 to 100 beats per minute. Bradycardic occurs in conditioned athletes when the heartbeat is less than 60 beats per minute. Some ultra-conditioned athletes have pulses of 40 beats per minute or less. Tachycardia refers to a pulse that is greater than 100 beats per minute but less than 250 beats per minute. Tachycardia is caused by a disruption of the normal electrical impulses that control the rhythm of the heart's pumping action. There are many factors that contribute to this condition. These include heart disease, congenital electrical abnormalities, high blood pressure, smoking, fever, alcohol, caffeine, medications and illegal drugs, an overactive thyroid, and an imbalance of electrolytes. Fibrillation occurs when the heart beats more than 250 beats per minute and results in an impaired ability of the heart to pump blood throughout the body. The most common symptoms are palpitations, chest discomfort, shortness of breath, fatigue, dizziness, and feeling faint. Treatment for atrial fibrillation includes drug therapy, interventional procedures, and surgery. Chronotropic refers to an increase or decrease of heart rate. Chronotropic drugs can be used to change the heart rhythm if it is too fast or too slow. In athletics, the use of caffeine and energy drinks will increase the heart rate. As mentioned before, ultra-endurance athletes often have very low pulse rates, thus regular aerobic exercise has a negative chronotropic effect. Review the changes that occur to the heart and lungs as a result of aerobic exercise. Refer to the beneficial adaptations of the cardiovascular system to exercise. Regarding the heart rate, it is important to wait 3 minutes before checking the pulse and determining if it is in the aerobic or anaerobic training zone. You will get an inaccurate measurement if you check the heart rate before this time, as it needs time to plateau. In this section, we will review how to determine training heart rates for aerobic and anaerobic activities. First, you must calculate the maximum heart rate using one of the following formulas. The age-related is the most popular, but the Carbonin and Best Fit formula are the most accurate because they take into account weight and gender. The age-related assumes that as a person ages, they are less able to work out at higher intensities, which isn't necessarily the case. Second, we must assess the resting heart rate in a morning when you can wake up without an alarm. As you lie in bed, take your pulse for 30 seconds at your wrist or gently at your carotid artery and multiply the number by 2. This is your resting heart rate. Third, subtract your resting heart rate from your maximum heart rate to calculate the heart rate reserve. Finally, calculate the heart rate training intensities by taking the heart rate reserve number, multiplying it by the respective training intensity, and then adding the resting heart rate. You will have the opportunity of evaluating these training intensities for yourself and someone else during this unit. In general, this diagram represents the 4 primary training zones. The lower intensity, 40 to 60%, is used as a warm-up for conditioned athletes and as a low intensity range for those who are unaccustomed to exercise. The moderate intensity, 60 to 80%, is the aerobic zone. The high intensity, 80 to 90%, is the anaerobic zone. And the 90 to 100% intensity is considered the ATP PC zone, where maximum and peak effort is required. This is reserved only for a short period of time for the elite individual. Refer to these next two slides and locate your sport and the corresponding requirements for ATP-PC / anaerobic glycolysis, which is the maximum peak zone, the anaerobic aerobic requirements, which is the high intensity anaerobic zone, and the aerobic requirements, which is the moderate intensity zone. For physical education, you could choose a sport or activity such as aerobic dance for a specific unit. For a fitness goal, you would identify the sport closely related to that goal. Refer to this slide to understand the training factors, guidelines, and sports that require anaerobic training. You will refer to this information later in this unit in an assignment. Interval training is an excellent training method to achieve anaerobic fitness and is a series of repeated bouts of exercise alternated with periods of relief or rest. Review the terminology on this screen related to interval training. So why does interval training work? First, because of the rest interval, the anaerobic glycolysis isn't taxed the entire time, which means lactic acid won't accumulate as quickly or excessively. Second, because there is less lactic acid, there will be less fatigue. And finally, this savings in fatigue allows the individual to work at higher intensities during the next work interval. There are 4 variables to consider when designing a program: the intensity or speed of each interval, the distance or time of each interval, using active rest such as walking or complete rest such as completely stopping between each interval, and the total number of intervals or repetitions completed during the workout. All 3 energy systems can be activated during interval training. The ATP-PC with sprints and shorter intervals, the anaerobic system with moderate distance or time, and the aerobic system with longer distance and time. However, most interval training programs are used to enhance the ATP-PC and anaerobic system. Refer to this table as a guide in your interval training. Sprint training, also referred to as speed training, is another excellent method to develop anaerobic glycolysis and is good for sports requiring a lot of running, such as soccer or sprinting and track. This will develop not only speed but also muscular strength. The focus is to sprint at 100% effort and long enough to produce extreme fatigue or acidosis. Because of the all-out effort, longer recover intervals are required. This is a good method to use after a foundation of aerobic and anaerobic fitness has been implemented and is usually reserved towards the end of the season when peaking is necessary. Used too much can risk overtraining and injury. An example of sprint training could possibly include running in all-out maximal speeds or supramaximal efforts. Acceleration sprints are used to train athletes how to finish strong at the end of a match or through the finish line. This picture shows the athlete running on a treadmill, which is a great way of increasing the speed to a sprint. You can also set up cones along a field or track and instruct the athlete to start at a slow speed to the first cone, increase to a moderate speed to the next cone, and then finally sprinting to the finish line. Refer to this slide to understand the training factors, guidelines, and sports that require aerobic training. You will refer to this information later in the unit as an assignment. The long duration, moderate intensity training, also known as long, slow distance, is a common element in endurance or aerobic training programs. The exercise will be 30 minutes to 2 hours with the target heart rate at the higher ends of aerobic and possibly into anaerobic zone. The moderate duration, high intensity training is also known as pace or tempo training. The intensity is higher, which means that the duration is lower. This is also referred to as aerobic interval training and is helpful for athletes who have plateaued. Short duration, very high intensity training is also known as interval sprinting, where the athlete alternates sprints and jogs for 3 to 4 miles. Speed play is similar to interval training, but the work and relief intervals are not timed. Exercise is continuous over a natural terrain and alternates between fast and slow exercise. This can be a good strategy to use once a week to promote teamwork and to improve both aerobic and anaerobic systems. Refer to the next slide for an example of speed play. The coach or instructor would call out the instructions to the team on the field using landmarks or cones for assistance. Cross-training is when an alternate activity is used besides the sport to develop endurance. It can be used to transfer training effects of one mode of training to another. It is also used to facilitate recovery from injury or prevent overtraining. The advantages include the enhancement of training, improvement of aerobic performance, and prevention of injury. For example, an athlete who has shin splints can cross-train on the bicycle instead of running. However, sport-specific training is still superior and cross-training never exceeds it. Water running is a popular form of cross-training and can be used for athletes who are recovering from injury. In conclusion, the concepts of genetics, detraining, and overtraining are presented. VO2 max, which is the body's ability to utilize oxygen during activity, is slightly genetic and primarily trained. Aerobic ability is also minimally influenced by genetics. Genetic ability is even less regarding skill-specific sports. Cardiovascular detraining occurs in a minimum of 48 hours, and one can lose all of its benefits in 4 to 8 weeks. This fact warrants the inclusion of aerobic activity over the weekend and implementing stringent cross-training techniques for injured athletes. Overtraining is the opposite of detraining and occurs when an athlete doesn't have enough recovery time during the week, season, and calendar year. Physical injury and psychological staleness are the result of overtraining and must be prevented as much as possible.